Your party, my party, this is the people's party. Your party, my party, everybody get on board.
A lot of the lovely people I'm here with have lots of information from the ABMR that they want to bring out to you tonight. From my point of view, working in health, I have felt that things could be a lot better. The government has been doing well in recognizing that chronic non-communicable diseases, hypertension and diabetes are on the rise, and we need to do something about them in terms of prevention. But the government need to be aware that these illnesses that are so prevalent, increase our risk of getting strokes and getting heart attacks and getting kidney problems. And because they're being unaware of these problems, they're not setting up the health service adequately to be able to cope with these problems. We have asked for the last several years, for example, for a CT scanner, so that when somebody on Montserrat gets a stroke or somebody has a head injury, that as doctors and nurses we can follow a protocol to make sure that we do the right thing for the person. Unfortunately, presently, getting patients in need of a CT scan, what they require, we need to medevac them very often to Antigua, and this often comes with a high cost. For Montserratians, you know, sometimes it's okay because we can refer them to the Community Services Department and they will offer assistance. They will write a letter to the hospital in Antigua and say that they're going to cover the cost. But if you're a non-national, our government cannot help you in that way. And therefore, as a non-national living on Montserrat, you should really want to make sure that the services that you need in your emergency are present on island. I've worked in that casualty department for the last 6 or 7 years, and we have felt the struggle. We have felt penny pinching. I've seen nurses turn off a tap from open the cupboard underneath the tap and turn it off under the tap because the government doesn't have any money to fix a dripping tap. I've seen nurses having to cut an incontinence pad into 16 pieces and place the little tiny piece of incontinence pad under the patient because we are so short. We struggled for months, I keep talking about for months, for over a year, for almost 2 years, for a cardiac monitor because it had fried knees and the government was not interested in replacing it rapidly. A machine that was supposed to help us to look after you in your time of need. A lot of people in the country, well, some people in the country who have a lot of money often feel that, well, if I get sick, I'm not going to bother with the health service here. I'm just going to fly to Antigua or further with my medical problem and get care. And people who have health insurance, I know a lot of the people who work for the Foreign Commonwealth Office, they have really good health insurance. If they cough the wrong way, they can be medevaced straight to Guadeloupe or to Miami. We do not have that opportunity, but these people need to realize that in a proper medical emergency, we medical staff often have 10 seconds or 10 minutes or 1 hour to save your life. And if we cannot perform in those 10 seconds, in that 1 hour, we cannot get you out of Montserrat to be saved elsewhere. We have in our hands up here copies of the manifesto that the government of Montserrat, that the MCAP government formulated in their last election, promising you improvements. And there wasn't a lot of improvement mentioned in health, but 2 of the things were that they were going to promise you a mammogram. They were going to give you a mammogram machine to make sure mammogram service was available on island, and that's been blown out to the sky. And they were going to make sure that ECG services are available on island. We have 1 ECG machine, and it's like the cardiac monitor has fried leads, but it's still working. Part of the reason why the leads are all broken is because we have to lift it from place to place or drag it on a trolley that does not have wheels. And we've asked over and over again, please just give us a trolley to put this piece of equipment on so that it won't mash up, so we can continue to use it. But still, we have the trolley that we have to lift, or we have to lift the machine off the table. Yes, it's only an ECG machine, but it sort of is the example of everything that we asked for in health. In their manifesto also they talked about hemodialysis, but still it was an empty promise because Yes, they might have a space in the new hospital for it, but they certainly don't have a plan to purchase hemodialysis equipment, and they do not have a plan to train staff to use it. What I'm saying is that government did not care enough about health. We are not in a position to help you in several ways in which the PDM government feel that we can help you. We want to make sure that in terms of emergency care that we are set up properly at the hospital so that in your time of need, we're not flying you out to Antigua. We were asked by Mr. Robinson to talk about how we're going to find the money to get this done. If you read the documents produced by DFID and by the government of Montserrat, you will realize that there's a lot of money in this country. In education, for example, the teachers, when they beg out for supplies, they're told that no, there is no money, but yet the government created what they call a new spend to give over $500,000 to their friend to run the school bus service, which made it more expensive anyway. And it's right there written down. I wish we could just give you out the information. Money is not the problem. The problem is that the hearts of the MCAP government have not been in the right place. Their minds have not been in the right place. Often the castrated ministers have no say in what goes on, and a lot of money is given away to friends of the MCAP government. While the rest of the people in the country are literally bawling because they find it hard to survive. They find it hard to make ends meet. I could go on and talk about things in health, because there are many. In terms of health, I'm just going to sum it up by asking you to put your trust in me and the PDM government, because I know what we need to have at the hospital in order to make things right in healthcare. And I know that there is enough money to make it happen, because where there's a will, there's a way, and where you have a government that has a clean and honest heart, we will make it happen. The one thing, and I've said it all before, I've said it on the radio and at the other meetings, the one thing I want to say to you tonight, the one thing I want to show to you tonight, my take-home message tonight, is that your present government is robbing you blind. Your present government is giving your money away to their friends for doing often nothing. And as Gregory keeps saying, we have a government that just moves dirt around and around and around and pays its friends for doing it. We have a government that had $5 million to break down Gun Hill and then take Gun Hill and put it in a swamp, as if they haven't taken all the land in Little Bay already. You're going to tell me that you have all the land in Little Bay to choose from, but the one place that you want to start building is in a swamp. God have mercy on us people. My message to you tonight is simply this. I would like you to get rid of them. I know a lot of you are afraid to put on your red shirt, and say go PDM, because I know just as we read recently on M&I Live, a lot of people in the country are afraid of the MCAP government. Don't be afraid of victimization. Just make sure that when you're at the polling booth, don't let them come in there with you when you're afraid of victimization. Go into the polling booth and vote for the People's Democratic Movement, because these people have a conscience. We are led by Don Romeo, who is a good and honest Christian man. Delron Ryan, who is extremely knowledgeable about the ins and outs of government and civil service. We promise to keep track of the money. We promise to not give it away to friends, and we promise to not just give the work to a chosen few. We want to make sure that people who come here from the other islands feel welcome. We want to make sure that the pay that you receive is sufficient so that you can feed your children and clothe them and send them to school. We heard recently that wearing red shirts versus yellow shirts will cause violence to start in the country. It is when you raise the gap between the rich people, when you increase the gap between the rich people and the poor people in a country, it is when you create hardship that we have seen in some of the larger Caribbean islands. It is when you make it so hard for people to survive that they have to steal for the money. That is how you create violence. That is how you create crime. If you want to save your country, vote for the People's Democratic Movement. Don't be afraid. The impact government, they've had a chance. They have, I can't even say that they have tried. They have done a lot of thieving.
Surely.
It is time for them to go. I am not afraid. I am not afraid. Don't be afraid. Simply, on election day, vote for the People's Democratic Movement.
Your party, my party, this is the People's Party. Your party, my party, everybody got